Okay. So now we'll be talking about the article Surgical Audit of Operated Patient in a Tertiary Care Hospital. So what is surgical audit? Surgical audit is a peer review assessment that is used to improve the care of the patient to ensure the adherence of the standards to enhance the clinical result by controlling the quality. The surgical audit is the standard approach to control surgical site infection in the hospital. Where does the term audit comes from? It comes from a Latin word audere, which means for the hearing. The process of the clinical audit is the improvement of the quality for better patient outcome by a systemic review care. So in the surgical audit, there is difficulty for setting the standards to measure the outcome variation. Systematic. This process is non-punitive, which is an educative procedure for improvement of the patient care outcome. Continuous systematic audit is highly beneficial for education, training, and overall health patterns. Healthcare workers are also interested in auditing and research methodologies. The study process is the assessment of the notes of the operative procedure, which includes detail like age, gender, diagnosis, operative procedure, and whether the procedure was performed in an emergency or elective way was recorded. The study concluded that systematic auditing combined with electronic record keeping contributed to these improvements and highlighted the importance of ongoing record audits to maintain surgical quality. The study has triggered three importance of the accurate and specific intervention to reduce mortality. The study reveals that the audit is used for the evaluation of the pre-operative consent form for the surgical patient to identify the critical gaps for the proper understanding. The study have revealed the requirement for the communication, the education of the patient, and the practice for the documentation for ensuring the consent. The audit process is less costly and also potential. By tracking metrics like disease profile, admission trends, and treatment procedure, hospitals can identify what is working well and where improvements are needed. This approach moves away from guesswork using concrete data such as hospital stay duration and mortality rates to make informed decisions about patient care and hospital management. And this study concluded that there is an increased number of surgery and elective procedure and spinal anesthesia under spinal anesthesia. Okay, so what is the, I mean, they have done a study, like it is basically homework for the hospital administrators, that is the treatment going on properly or not. This is the science behind it. So if you take into consideration the 14 points, what the researchers have jotted it down from a already done conducted research. So first of all, they have talked about the what is surgical audit. It's a peer review, means group of doctors, administrators, nurses, they'll sit and they'll decide what is the study. And second point is how it is a standard approach to control the surgical site infection in the hospital. Okay. Now, the process of clinical audit is the improvement of quality of better patient outcome by systematic review. Okay. Are you willing to give any viewpoint on this? Yeah. Please tell your viewpoint on hospital cases, bacteria, microbiology. What do you want to tell?
Microbiology having its own background to control the entire environment and health of the being in global scale. So, to confirm microbiology in practical form, there is a huge course in different branches in different medical field. So, microbiology is also dealing with the upliftment of the health of not the human being, but all the beings of the world, plus to revive, revive and create different types of diseases and to control it. Also, it is giving the ways and means to create different antibodies to control the harmful microbes throughout the world, especially for human being. So, microbiology is a great science in negative form as well in positive form to develop the depth of research in the field of medical science and medicine. Thank you.
Okay, so now you can see that it has been jotted down. There are 14 points jotted down by Dr. and Dr. Sripad Misra and Dr. Bhagyashree. So there have been serious discussion on the points jotted by you in the article. Now we can see that out of 14 points, what came into our mind is the interplay of the microbes, how it can be controlled in primary and secondary level of prevention by the scientific method of audit, a peer review assessment. Thank you so much.